So I want to send a warm welcome to you all. My name is Noah Gokul. I use they, them pronouns. I'm the program manager at IDHA, and I'm also the moderator for tonight's event. And I am going to do a brief visual description. I am a brown person with long black hair. I'm wearing some pink glasses. I have an orange shirt on. Behind me in my background, I have a white wall. I want to welcome you all to our events, Global Solidarity for Liberatory Care. And I'll do some opening remarks, but I'm really excited to just get into talking about the importance of global solidarity in this moment when it comes to mental health liberation. So really excited to have these panelists in conversation. So I want to start out to really ground this panel in the moment that we are in with multiple genocides happening and a lot of grief from a lot of weight happening in the world, a lot of pain and suffering. And I want to welcome that grief into this space tonight as we're talking about something that is also very intense and heavy, the abuse of human rights for people who have been diagnosed with a mental health disorder, a really powerful panel talking about this, but also a very heavy conversation as well too, thinking about all of the things that we are fighting for in this world. And so if you're bringing your grief into this conversation as I am, that is very much welcome. This slide was also very much inspired by Umo Saila, who is an amazing person who talks about grief and genocide. So some accessibility information here. We have closed captioning available for this event, so you can click the show captions at the bottom of the screen to turn this feature on. We also have a live transcript, so you can click on the small arrow to show that and view full transcripts. We also have two lovely ASL interpreters today with us, and so you can toggle between speaker and gallery to view the event, to adjust your view. We are recording this event, so we will send it to all of the people who register after. So if you're not able to attend this full event, do not worry, you'll get a recording. We also have someone handling the tech support. Nia is going to be helping out with that. So if you have any issues with tech, you can feel free to chat them. They are under Nia, IDA Tech in the Zoom. And if you have any other questions, you can also email us, contact@ida-nyc.org. We invite you to use the chat to engage with the panelists and one another. The community agreements do apply to the chat, and I'll be sharing those in a moment. But we welcome you to just engage with others, share resources. And the chat can be very active. So if this gets to be a little bit overwhelming for you, then you can hide this function by clicking the chat button and hiding that. We also will send out an anonymized transcript of the chat, which can also have a lot of useful resources in it. So panelists may not be able to answer all of the questions. We will have a little bit of time, hopefully, for Q&A at the end, but we hope for people to be able to engage with them beyond this event. So I'm going to briefly share about IDA and who we are. We are the Institute for the Development of Human Arts, and we are an organization that is a community of current and prior mental health service users and survivors, psychiatrists, psychologists, and other clinicians, activists, and artists who come together to transform mental health care. And what we do is advance critical, effective, and scalable alternative approaches to mental health through collaborative education and community development. And so what we're doing here is trying to, really integrate experiential and academic knowledge to really try to break down this idea that those who work in mental health, are not the only experts, and we're trying to shift those power dynamics so that people who have lived experience are also experts. So here's our community agreements that we would invite you to, be in community and take part in with this event tonight. So the first one is shared expertise and wisdom. Everyone brings their own expertise to the conversation so we can respect each other's various expertise. Collective liberation, that overcoming oppression aids everyone's liberation. So we are here to challenge all forms of prejudice, and we educate in the spirit of solidarity without criticizing who we are as people. We also listen like allies. We respect a wide diversity of choices and perspectives. Even when we disagree, we don't judge or invalidate other people's experiences. So that applies to the chat. And we also have a team member, Jesse Ida, in the Zoom to moderate and uplift the chat if needed. We also think that conflict is normal in spaces where, we're talking about, sometimes very complex things. And so we expect this disagreement and multiple truths to show up in this space. And so, we use our community agreements for that. And we also invite you to notice when you are feeling sort of this moment of conflict in yourself. Where do you feel this tension in your body? Is this from learning new ideas that challenge you? Is this because someone said or did something to reinforce oppression? We also have a harm response form where you can report any harm that you feel and in the space that you would like the IDA team to be aware of. And we give thanks to Spring Up, another organization we're closely aligned with for these approaches to conflict and harm. So this is a panel inspired by transformative mental health and wanting to uplift different approaches to transformative mental health, and as it's inspired by the work that we do at IDA and the curriculum that we have. So we wanted to give you a kind of loose approach to what we're talking about, which is systemic change, that there's multiple intersecting systems of oppression that impact our society and have an impact on our bodies, minds, and communities. That experiential knowledge is one of the most powerful forms of knowledge. And so best practices for trainings and our care is created by or in collaboration with those most impacted, and holistic care, that we want to uplift the many voices and frameworks that bring us fuller understanding of mental health, and we must address the whole person and the broader societal context that they're in. Kind of acknowledging also in this panel, particularly the diversity of language that may exist. And so we wanted to ground this particularly because we are in conversation around movements that exist across the world. And these liberation movements may use a variety of terms and frameworks to describe their experiences and approaches to organizing. So this might include using mental health, madness, or also psychosocial disability. This is a term often used in the Global South, signaling a connection with disability frameworks and right-based discourses. There's also a linguistic diversity on this panel, and so we celebrate that. So we want to be, acknowledging the rich lineages that continue with language, and also aim to uplift the multiple truths and the frameworks and identities, that exist in the global South that are not, one unified voice. So there's many different kinds of approaches. For people who are tuning in for the first time and hearing some of these concepts for the first time, we also want to aim to define some of these new terms. So let us know if you are lost and want some kind of knowledge, and let us know in the chat if a term is unfamiliar. And our panelists are going to do the best to also try to explain what they're talking about if they're using certain terminology. So I want to take a moment because this panel is talking about global solidarity, and particularly the global South, and working to fight against human rights violations for people with psychosocial disabilities. So I want to take a moment to honor Bhargavi Davar, who was an amazing global leader in the ongoing fight to realize human rights for persons with psychosocial disabilities, who unfortunately passed away last year. Well, we were very fortunate to have Bhargavi as one of our faculty members at IDHA. She was the director of an amazing organization that still exists, the Bapu Trust for Research on Mind and Discourse in India, and was also the convener for Transforming Communities for Inclusion, TCI. So her work through these organizations was to advocate for the full realization of human rights for people with psychosocial disabilities. And the topic of today's event is deeply connected to her life's work. So we would have loved to have her voice on this panel. And her memory is definitely carried with us as we, continue to continue her legacy, really, to fight for mental health liberation for all. So want to honor her and may her memory be a revolution. This is an event that's part of an ongoing series about transformative mental health and diving into, timely topics as it has to do with this. So today is a really important dialogue with some incredible voices who are also faculty and contributors to the core curriculum. And we'll talk about the core curriculum at the end. But we are seeing the ongoing erosion of human rights within the U.S. right now. It feels very, very, tangible, and also globally. And so we felt the need to convene people and have this event because people who have psychosocial disability or MAD, disabled communities are under increased threat because of this. And there is a growing emphasis on control over care, paired with the biomedical models of mental health. This often undermines the rights of those who are in distress and leaving them to be vulnerable to systems of abuse and exclusion. So in this context, we really find it important to look beyond the borders and learn from the global movements that have long fought for the rights of people with psychosocial disabilities to shape their own care and live freely in their communities. So under this umbrella, there's many, many networks and groups in the global South with different languages, priorities, experiences. But today we want to come together and talk about solidarity and what does that look like. So cross-border solidarity is more important than ever as we push back against these punitive carceral mental health models backed by right-wing political agendas that are becoming more pervasive across the globe. So today's panel is bringing together the voices from all of these different perspectives who are committed to shifting the mental health paradigm. And so they'll share their perspectives on the challenges we face and the strategies that we need to transform our systems. And also drawing from their real world examples of organizing in the global South. And so we'll discuss the power of community solidarity, support, interdependence, and collective action in reimagining care. So this conversation will definitely emphasize, you know, the importance of global solidarity and local activism working together to prioritize the dignity, autonomy, and choice while rejecting coercion and institutionalization. So, you know, we're joined by folks who this might be like newer to you if you're joining from the US. I am definitely not an expert for sure. I'm very humbled and honored to be in community and moderating this panel tonight of such brilliant minds who are part of this global sphere of activism. And I'm really, really inspired to, you know, think critically. And I hope that this panel inspires us to think about our collective role and joining together as a global force. So thank you again for joining us. So with that, I will invite our panelists to introduce themselves. Each of them will have 4 minutes to share about themselves, their name, pronouns, and a brief prompt. Just share what about your work, essentially, and what brings you to this panel tonight. So if we could hear from Benin first, I would love to invite Benin to introduce themselves.
Yeah, thank you very much. Thank you very much, everyone, for this wonderful event. Now, I'm a mental health care from Uganda, and I'm the founder and executive director of a lived experience organization based in Uganda called Mental Health Recovery Initiative. I've engaged in advocacy, including strategic litigation in demanding for reforms within the mental health system. And it was really a great privilege, and it is still a privilege to be in partnership with the Institute for the Development of Human Arts. I was part of the core curriculum development team, and I'm glad to be here tonight. Thank you very much. Thank you, everyone.
Thank you, Benin. And just a reminder for you and the panelists, if you wouldn't mind doing a brief a visual description.
Oh, yeah, thank you very much. As I've said, my name is Kabale Benon. Pronouns he, him, and behind me is a white background. I'm a Black African based in Uganda, and I'm putting on glasses. Thank you very much.
Thank you, Benin. So now I want to invite Danius to introduce himself.
Thank you. Hello to everyone. I'm happy to be part of this panel. I am Danius Puras, pronouns he, him. I am a white man in my 60s with grayish brown, light brown hair, and speaking from my office in Vilnius University Hospital, and there is a white wall behind me. Just briefly about my activities, and I think why I'm here, mainly because besides my experience in my region, which is Europe, and sub-region, which is Central Eastern Europe, I have served for 6 years from 2014 to 2020 as a United Nations Special Rapporteur on the right of physical and mental health. And my priority was mental health and human rights, and I was happy to contribute to global discourse in the field of mental health and human rights, and I formulated the position of my mandate. And in my reports, thematic reports to UN Human Rights Council, but also country mission reports after my official missions to 11 countries in all regions. And since then, 5 years passed already, so I do not have any hat now, but I'm happy to still be quite active as a former special rapporteur, and which means that I'm happy to see that my contribution was meaningful, and happy to continue these activities which are very much needed for all of us. So thank you.
Thank you, Danius. And next, I would like to invite Daniela to introduce herself.
Hi, everyone. I'm very honored to be here. My name is Daniela. I go by she, her pronouns. I'm a white woman with black hair. I'm wearing a black shirt, and behind me, there is a white wall. So I'm a clinical psychologist from Brazil, and I'm also pursuing my PhD in the same field. But my trajectory is about being an activist in the anti-asylum movement in Brazil and also Latin America. And my research mainly dives into how cultural difference shape the way mental distress is expressed, pushing back against the idea that psychiatry speak a universal language. So it's mainly about that. I'm happy to be here.
Thank you, Daniela. And next, I will have Alberto introduce himself.
Well, thank you for the invitation. My name is Alberto Vasquez. My pronouns are he, him. I'm a brown man with curly, long, dark hair and salt and pepper beard. And I'm wearing black glasses and a colorful shirt. I'm a math disability activist. I'm co-director of Math Thinking, a new initiative that aims to explore power and solidarity in disability movements. Originally from Peru, but now based in Geneva. I'm also a human rights lawyer, and I work as a consultant on mental health and human rights for different organizations and agencies at international level. And I'm also a founding member of Red Esfera Latinoamericana por las Culturas Locas, la Diversidad Psicosocial, la Justicia, el Buen Vivir y el Derecho al Delirio, which is a regional math network in Latin America.
Thank you, everyone. And again, I'm just really, really excited and honored to be here with you all, to be in conversation. And I wanted to, say that we have some questions here. We have maybe 4 questions, and then people hopefully will have time to welcome some questions from the audience. So please save your questions, but you can feel free to put them in the chat. And I hope that we can try to answer some of them. And for the panelists, again, feel free to come in to share your thoughts about any of the questions that are shared in no particular order, and jump in whenever you want. So the first question is really to contextualize this whole conversation that we're having tonight. So, we are in a time that is ongoing with many, many challenges, right? I was already naming the authoritarianism in many places, the repression of voices and human rights, economic decline, genocide, and there's also the environmental collapse. So how does this current sociopolitical landscape that we are living in today, how does this shape the global fight for mental health liberation? And what unique or deepening challenges are we up against? So that's for anybody to jump in when you would like to answer.
Thank you very much, Noah. I'd like to go first as I attempt to answer the question. I hope you can hear me clearly. As in my introduction, I'm a person with a psychosocial disability and I'm based in Uganda. You find that, even here in the global south, there has been a shrink on the human rights of not only persons with psychosocial disabilities, but also others within the community and other areas of life. Like in Uganda, we have witnessed the closure of the DGF, that is Democratic Governance Facility, which was really a broad funding to human rights activists and advocates within Uganda. We've witnessed the closure of the UN Human Rights Office, and all this really means a lot when we talk about persons with disabilities. For example, the UN Human Rights Office has been a UN monitoring agency of which it can monitor the implementation, promotion, and protection of rights of everyone within the country. So from the global perspective, I find that this has been really a big issue that needs to be addressed. And as a global coalition, I think it calls for a lot of resilience and, commitment on self-advocates to ensure self-determination in the fight for the rights of persons with disabilities, especially for this case, persons with psychosocial disability. I would like to submit at that point. Thank you.
Can I maybe share some this global landscape? First of all, we should maybe remind to ourselves what was happening before and after good decisions, many good decisions after World War II. There was some period of so-called Cold War. And I elaborated on this in my reports because it happened so that I was witness on other side of the wall, which is sometimes idealized by, let's say, people who were addressing and fighting with the oppressions of capitalism and neoliberalism. And it's fully understandable when social economic rights are threatened, when there is inequality. Of course, it is very detrimental to mental health. But sadly, what was happening on the other side was not better because civil and political rights were oppressed. And so this is lessons for all of us to see how things go wrong if human rights are not fully embraced, if they're taken selectively, with good intentions often, but still taken selectively in both camps. After all this long Cold War failed also in other fields, but we are speaking now about mental health of everyone, because we know that for mental health of everyone, we need to address inequalities, violence, all forms of violence, all forms of discrimination in all settings, starting from family, going to school, workplace, community, society at large, and in health and mental health settings, of course. So that there was some improvement after 90s. In the 90s, it looked like now we have a chance to embrace our human rights, but we know what happened after and what is happening now. We are now witnesses of attacks on universal human rights principles from different sides. So this is not to become too pessimistic, but this is just to assess the situation when human rights of everyone, let's say, especially of all marginal groups, are attacked. And then we should think, maybe in later questions, we should think about tactics, how much we form coalitions and how much we go and address just mental health related issues and how much we go in broader coalitions. But this, just to conclude for now, this, when I was part of special procedures as a mandate holders, and we have special procedures coordination committee, so we were raising issue when we were going to New York, we were raising signaling that we saw very concerning development that human rights were sidelined from these three pillars. Yes, we know that the human rights, development, and peace and security equally important. And we started to listen from more and more often that human rights is not for New York. Maybe it's for Geneva, just, you know. For New York, it's more serious things. And you know, what were these strong men who were moving this agenda that, you know, peace and security, development, as if it can happen without human rights. It for sure it was very dangerous development, and we see some consequences now. So just I wanted to elaborate a little bit on general picture, which is beyond mental health services, but this is very, very, very important to know.
Yeah, thank you, Danius. It's very telling that, you know, the US has never not, you know, prioritized the human rights aspect of the UN work. And I think it's easy right now to see also with the Trump election, and I'm located in Germany with the AfD. There's a right-wing party in Germany that is rising, and there's this huge concern over the degradation of human rights. And even with the way that we were organizing this panel, we had our amazing panelists say, well, hello, actually, this has been happening for a long time. So this is not just a moment right now, but it's been, so thank you for giving that historical context. And yeah, I saw Alberto was interested in saying some things.
Yes, I think we can talk actually very long about all these challenges, but I wanted to build on what Benon and Daniel said in the sense that we have seen a backlash against human rights, and I think that will impact organizing, that will impact how we as different activists in different sectors, we're trying to make a difference. But also authoritarian governments tend to go after difference, no? We're seeing it now with the Trump administration, but we have seen it everywhere, no? LGBTI+, indigenous communities, and we, at least us that are part of the psychosocial disability / MAT movements, I mean, we tend to be a scapegoat also in many cases about violence, about what is the root cause of some of those challenges that societies experience during harsh times. And we're living it now. We're seeing mental health laws, we're trying to be tougher on those that are living in the streets and those that are experiencing crisis. We've seen it in the US, we've seen it in Argentina, we've seen it in Singapore. Cities like Curitiba has passed tougher legislation. And also comes with institutionalization, no? And Daniel didn't mention, but there is also the rise of something that we thought it was reducing, which is the political abuse of psychiatry. No, countries like Iran, Russia, or China, we have many reports of people of countries using mental health service to repress dissent. No, I think that's a very important aspect of this conversation. And a second one I want to bring is the economic impact in terms of what we're going to see probably and is cut on expanding in many countries, and we're seeing it. Argentina did a very, very harsh fiscal adjustment, one of the worst that we have seen in different countries, and that will impact us again, and will impact. So I think this cutting in not only in international aid but public expenditure is something real that is already impacting many people and impacting organizing and breaking safety nets and taking away pensions and housing and benefits. So it's something again that we should be concerned. And a final idea I want to bring is something that you mentioned, Noah, which is there is grief and there is pain because of this polycrisis we're living today, no, across the world. And I'm very sure someone somewhere is already thinking how to take advantage of it to sell us more biomedical responses. And that's how it works. And and rather than actually addressing the root causes of this pain. No? And I think there is a responsibility on us too, in terms of, are we ready to take over with a different narrative about how do we deal with this pain and this this reality in a way that is not the traditional way of mental health services. And I think if we lose hope, we lose a lot. I think it's going to be very difficult to organize. Doors are going to get closed. Funding is not going to be available. We are hurting to some extent. But I think this is the moment that we need actually this transformative action, that if we want to make an impact.
Yeah, I just want to add, like, I was remembering that recently we had Bolsonaro in Brazil during the pandemic, and all these challenges that the question says about, I think we experienced. And one point for me was that I kind of feel that we need to fight for basic human rights that before were not like the goal of the movement. We're like fighting about different mental health cares and treatments and everything. So I just feel like a backlash also in the what we need to fight for. So like food security became like the main goal, or like housing and something related to like the basic needs of people. So I think this kind of challenge in the political repression authorities make the challenge about the mental health movement to talk about mental health like in a very broad way. That's like the basic needs. And yeah, that's one point for me that I can think now.
Yeah, thank you all. It was really nice to hear from some of your openings, what the kind of work that you're all engaged in. And I'm going to skip around with our questions a little bit, because I think for myself and maybe people who are tuning into this panel, they might be curious to learn more about the specific work that you have done within your context to resist. I'm curious to ask this question of, what has resistance looked like to biomedical or coercive mental health models within your context over time? And considering this current landscape that we are, and the current challenges that we are, how are you kind of thinking about the resistance that you have done to these models now? So yeah, for anybody to think about, or just kind of share. Alberto, you talked about your work with Red Esfera, and yeah, we're curious to talk about what does the resistance look like?
Yeah, that's tough in a context like this. I think there is so many ways to do resistance, and in Red Esfera we're a network of different activists and organizers from several countries in the region, and many of them with their own organizations working in the field and trying to do impactful work. And I think one first aspect that I will raise is, I think it's very important just to claim the space and claim that you exist and you're still there and you will resist. And I think that gives hope to people, and for us especially that are doing the work. But I think a second aspect that comes to mind is, how do we organize ourselves with different organizations at different countries to put enough pressure to achieve something concrete? And I just to put an example, something that in Red Esfera, we're a small organization with few members, but we were, in the case of Argentina, our member from Argentina, for example, was very active in connecting with disability networks and other spaces that were rejecting the mental health reform, and we took action, and we coordinate action with other organizations. We managed to get enough pressure in the government of Argentina to postpone the mental health law. I wouldn't say Red Esfera was a key actor on that, but we play a role, and we try to play a role as part of an ecosystem. And I think that's a very important aspect that sometimes we miss, that we are not alone. We need to work with other organizations that are aiming for the same. No, so I think that's the second part. And the third one is we cannot give up in our own knowledge and in our own practices. I think building something, for us at least, from the MAT movement, building something outside the system is the best way to resist, I think. Is offering something that we feel failed states are not providing. And it's about trusting in our own communities and trusting in our own knowledge. And I think that's something we need to keep doing. Our peer support groups, our different ways to support each other and create livelihoods. I think that's something that we need to invest, especially in those moments of resistance.
Thank you very much, Roberto. I think I would like to re-echo the perspective from the Global South. You find that the current coercive system, where we find institutionalization is something that is foreign in the Global South, and it's more of a colonial legacy. And I would like to note that even before the colonials came to the Global South to divide the partition and scramble of, countries, there was already existing mechanisms. There are already, what I can term as, traditional mechanisms of handling, mental health challenges, where we define traditional healing as one of them. And I would like to emphasize that even up to now, however much there are institutions that have been built, constructed to treat and manage mental health problems, you find that the movement has been in terms of creating peer support groups and also emphasizing community support groups, where you find that in Africa, for example, the family is a very strong bond. You don't know where you find relatives, and the family system itself has resisted as in terms of not embracing the colonial legacy, however, stressing the point of, depending on traditional mechanisms of treatment and care of people with mental health problems. You find that churches are in place, but still spirituality plays an important role. And you find that spiritual intervention is also one of the aspects of resisting the coercive treatment and the care of people's mental health problems in institutions. I submit. Thank you so much.
Thank you, Benan. I wanted to jump in. I know, Daniela, I wanted you to speak next. I just wanted to jump in real quick and say something about the unifying of the kind of potential with these organizing efforts that you were talking about with Alberto, with Reda Sfera, and I was thinking about the Lima Declaration that the group put out, and how powerful it is to have this, and then also to have the Bali Declaration created by the groups in Asia, and how these kind of declarations are speaking against the exclusion of people with psychosocial disabilities, and really to see how these kind of collective efforts kind of pop out throughout the world through this, and also even just the emergence of the idea of a psychosocial disability as a unifying factor for many groups throughout the global South to resist and to identify with. We'll talk about that later with language, but I'm just thinking about the possibilities with the resistance, so on to Daniela.
Yeah, I resonate with that also. I just want to say that there is a saying in the movement here that when we set free the patients from the psychiatry institution, we also set psychiatry free. So it's kind of how psychiatry language has shaped the way that we express our feelings and sad and anguish. So like, I think this fight is also happens in a very micro level where like people are identifying themselves with a biomedical model and a way to see as a disease. So I think also the movement has to work against this stigma in outside the service, outside the mental health service. And I also have like the pre-support group, but there's a great experience in the favela that I work here, and we have like a garden from a school that we occupy. And before that was like people put dead bodies and dealers were like trafficking there also, but now the community occupy and like, there's a garden with different kind of foods growing, and people like from the service and also people from the community that just want to take like a plant, or people who live in the streets that just want like to talk with us, go in this garden. So it's like an open door. And I think that's very interesting because it's outside the service, but also related to the mental health service and challenge a little bit this way of seeing like depression, anxiety and panic attacks and so on, like this language, psychiatry language in a way that describe, of course, we have mental health problems that it exists, but also I think psychiatry is shaping our daily lives in a very micro level. And one of the fights, I think, is to work with that kind of different ways of expressing. I also think about production of art, culture. It's just one example that I'm sharing with you, but there's different ways like to work within the territory that people have more agency in expressing their distress in different ways. So this kind of what this question gets into.
Yeah, thank you very much, Daniela. I would like to supplement on what Daniela said, concerning the language that is it. For example, here in Uganda, even in the Trial and Indictment Act and the Magistrates Act, there has been a language, that has been borrowed from psychiatry, but as a form of resistance, we had to take on, litigation, strategic litigation as a form of resistance to ensure that such derogatory terms like imbecile, lunatics, such derogatory terms needed to really to be challenged within our laws, and we had a successful litigation in that direction, and we are awaiting for reforms. Thank you very much, Daniela.
I would like also to comment on this. To be special rapporteur is very good. You are in very good position to see what is happening globally. And for example, for first 3 years, I did not go for reports. I was exploring the situation, and I had to see the global situation. So for me, it was so amazing to see all these examples of resistance, mainly by grassroots organizations in all regions, also from bigger national and regional organizations of users, ex-users of mental health services. I even did not expect that I will receive so much support from them, because of course, after my reports, I needed some support. But then I want to, I remember how it started with my region when we, it's again about biomedical overuse of biomedical model, because again, in that part of the world, on the other side of the wall, we were waiting for, let's say, more psychosocial interventions, because Soviet psychiatry was brutally biological, up to that extreme that was political abuse of psychiatry, but for everyone it was just high dosages of psychotropic medications for each case, of rebellious adolescents, whatever, whoever. And so, and can you imagine disappointment when finally we are in connection with the rest of the world, and consultants come from Western part of the world and tell you need good medications. that all these talking therapies is nothing good. And now we have very good medications like Prozac, so you have high rates of suicide. So you just have to reimburse all good medication, and that's it. This is what mental health care is about. And so that was 90s, in the 90s, when biomedical model was starting to celebrate victory, yes, because they told we know what to do there in the brain. Soon we will, you will receive more exact instructions about markers and everything. And then, yes, and then when I was special rapporteur, I used this experience from my region, but also I was collecting testimonies what is happening in other regions, and how ironically, maybe with good intentions, maybe biomedical model promised to empower and destigmatize and end discrimination. Yeah, because we will tell that this is not about laziness. This is about, like other diseases. And instead, what we see now, disempowered with excessive use of biomedical model, and then people with lived experience, they now are luckily not in all cases, but on the same level as experts, and this is a good thing what was happening. But of course, we have a lot of challenges, obstacles. I should not say that we are winning now, but we are not losing so seriously as it was in let's say 90s or on the turn of centuries. Now situation is better, but my maybe last comment for now is that I was often thinking that what happened, why Italian reform was not, let's say, replicated in many parts, maybe in South America more serious, but almost nothing in Europe. And maybe because it was unlucky, unfortunate timing that at that time, all these so-called miraculous medications came. And then it was switched to biomedical model instead of supporting and reinforcing what the Basalia reform and many, I don't know, but just just now I started to think about that, how to explain that not so many countries used this opportunity at that time, but we always can do this now because we have more evidence now about not only from human rights perspective, but from evidence. We have more news from science that without human rights-based approach, mental health care cannot prevail. So.
Thank you, Danius. And yeah, of course, it's remarkable to see how this norm of our current mental health care is really not that old. 30, 40 years of this kind of model of approaching mental health with, medication, and, it's a disease that can be cured with a diagnosis and medication. And then this approach of wanting to globalize that as global mental health to, basically export this kind of approach across the world. And now we have the resistance to that. So, we're talking a lot about the challenges and the resistance that you all are part of or know about in your local contexts. So this panel is talking about solidarity. So I'm curious to talk about what that means, and what does global solidarity mean to you? And how do you see the relationship between these local, groups that are working to fight for human rights as for psychosocial disability, and then regionally And also globally, how do we resist? What is the global solidarity to that?
I'm happy to jump into that question, and maybe starting by saying that I think there is many ways we can understand what solidarity means, and sometimes it's a buzzword that we use for just signing up on somebody else's statement, and we don't do much more than that. But I think it that term that a working term at least we use in a space where I'm part, which is called the Symposium on Strength and Solidarity for Human Rights. It's like we understand solidarity as political action in someone else's terms. So there is an element there of deference, now to let those bearing the struggle, those that are being affected on the rights, to decide what's the best course of action and how we can support that. No, it's not just doing partnerships or collaboration, but it's actually taking political action on someone else's terms. And I think in that context, I think it will be a mistake to keep relying on those organizations and systems that to some extent brought us here. And I think we really need to think where we are today and where we're going and internationally in terms, I don't think I'm being apocalyptic, but the national order is going to change soon and fast, and states are prioritizing their own interests. And for example, the United Nations, the UN, despite so many good experts, as was Daniels before, or currently the Francesca Albanese, the Special Rapporteur on Palestine, for example, to put two examples of people that have done good work. The reality is that the UN, for example, is a system that is defined and disempowered, and we have seen it again and again through all these crises. So I think we really need to think in terms, and I'm bringing that because I think if we're going to talk about solidarity, we need to realize that this is about how do we support each other to make an impact and build power, but that means first looking beyond your close circle and thinking about not only other movements but other struggles. I think how do we connect different struggles in a way that we can build enough power to resist, and I think one example of what we were talking about, for example, in terms of the race, the involuntary commitment being something that may increase in some countries. I think how do we mix, for example, people working on housing rights and on poverty, on mental health, math activists, people working on drugs and human rights that are also targeted by those. So how do we work together to do something that is meaningful? But looking at what you're asking about, the global and regional and local dynamics, I think those that are working at global level, we also need to realize we need to defer to those that are in the grassroots organization doing the work, and probably ask if they have any call that we can respond to. I think it's very important to have that two-way all the time. And just a final idea on this, which is, I think you started this conversation talking about this is a moment of pain and grief, So I think that moment also is an opportunity to offer our knowledge, our expertise to other activists and movements that are also hurting, and I'm thinking about how they can deal with this polycrisis. So I think we have something meaningful today to offer to other human rights movements, and I think that's an opportunity to build from there a common ground for action.
Yeah, thank you very much, Roberto. I think to add on what you said, we have also witnessed, like at international level, for example, the coming into force of the UN CRPD, the United Nations Convention on the Rights of Persons with Disabilities. I think it has been really a great effort. Signaling solidarity between persons with disabilities, including people with social disability, coming together and, demanding and advocating for the recognition of their rights, For example, the right to access to justice, the right and freedom from torture, cruel, inhuman, and degrading treatment, the right to live independently in community. I strongly believe this has been, collective effort by persons with disabilities. And for example, when I come to the African continent, we have recently witnessed last year the coming into force of the disability protocol to the African, Charter on Human and People's Rights. So this draws down to country level and enactment of laws and policies that are in conformity with the human rights of persons with disabilities. So all this to me signifies the global solidarity, driving into one direction to ensure that the rights and freedoms of persons with disabilities are, promoted and protected by governments and fulfilled. Yeah, I'd like to submit at that point. Thank you.
Thank you, Ben. And I'm glad that you brought in the psychosocial disability and the CRPD, because I think just in the same breath, Alberto was talking about the failings of the UN, right? And so it's like we could acknowledge the multiple truths here when this this convention really ignited a whole different framework for how we can see mental health that is focusing outside of the global north, right? Because for a long time, the global north was dominating the mad activist movements, and the voices were about this kind of resistance against psychiatry, where that kind of language or framework does not really make always so much sense in the global south, when psychiatry was more of a newer colonial presence. And so it was providing such an alternative, body of knowledge really to organize under. And at the same time, we see the failings of how this sort of legal framework, with Palestine, right, where we're not able to actually enforce these human rights violations when it comes to the genocide happening in Palestine. And so there's a lot of things to weigh when it comes to the kind of solidarity that this legal framework brings. But I think it's really important to bring in the CRPD and how important it was to many groups across the world. And I think it also is, very telling, right? That Danius was saying how the human rights priority was not in the US, it's not a priority, and yet we have so much human rights violations in the US, and how the possibility of organizing through this kind of psychosocial way is an interesting thought, because there is plenty of mad people, people with a mental health diagnosis who are having abuse in the U.S. But we don't use this terminology, and we don't know all of the people in the global South who are organizing with it.
Can I add on these three levels? When you ask about relationship between local, regional, and global resistance, my observation is was especially during my rapporteurship that we have very good grassroots movements, civil society in many parts. Of course, the danger that space for civic space is shrinking in many countries, so this is not good also to our field, to mental health. But then maybe paradoxically we have quite a good situation on top globally. I mean progressive resolutions of UN Human Rights Council, 4 of them now, 4, yes, 2016, 17, 2023 on mental health and human rights. WHO documents, which I did not expect that I will see such documents like from 21, 23, where it's very clear messages to governments. But then in the middle, we have some, I don't know, stagnation or paralysis that governments, especially on national levels, governments with psychiatric professional groups, they keep status quo. Yes, they keep, and even these so-called alternatives, which are recommended now by World Health Organization, non-coercive mental health alternatives, we see good attempts, but we see also attempts. I mean, we see counterattacks from mainstream. And even sometimes feeling that situation in global north maybe is worse than in global south. Like with Alberto, we were involved in Norwegian stories, which, you know, looks like Norway is good in human rights, but when it comes to mental health, it's a very sad situation, you know. And so here we should think, how could we be more effective, if possible, with this decisive level? How to, even World Psychiatric Association, no, they tell, let's substantially reduce coercion. But I did not hear so much of this from national psychiatric associations. They're not very happy about this, because it's a power game, you know. So just some observations.
Yes, thank you, Danius. And I wanna pass it over to Daniela, because I remember in our call before we talked about solidarity and that word meaning different things in different contexts. And we'll have a question about language, but I would love to hear from you and what you think about solidarity in your context.
Yeah, that's a very tricky question for me, actually. And I was thinking to find a common ground between what we mean of what global solidarity is. I think first is to understand that every resistance and every strategy, local strategy, works for like a specific context, and we can like just find a universal way of dealing with global solidarity. So I think this is very important because like I can give an example, because the recovery movement in the United States and also England also came to Brazil, like in the mid 2005, something like that. And I just have a feeling that what recovery encompasses of what autonomy is for mental health users is very different from the needs of mental health users in Brazil, and what autonomy means in Latin America context as well. So I was thinking, we have a lot of different types of resisting these biomedical models and coercion and authoritative governments, but I think every country and every context and cultural context has their specific ways of dealing with it, and this should have more like conversation like we are doing now, open more this polyphony as the principle of IDHA that Noah said before. And not to impose like a universal way of doing that, but also how we can find a common ground respecting each ways of dealing with that. So that's the first thing that came to my mind. And by saying that, I mean that we need to do this kind of conversation, but also deal with these power relationships of what global north. I think sometimes use global south as a laboratory of their experience. So like I was thinking about now, in psychiatric epidemiology is very important because we need like these numbers to build surveys and treatments, but we also are translating and adapting from the WHO instruments and data. So I think we're always doing that, like this global north conceptions, and implementing to Brazil, like to get some funding and to participate, to engage in this international discourse. So it's very tricky, like how we can make the local resistance and regional resistance, like to encompass more in this international conversation and international rights. And yeah, just some thoughts.
Yeah, thank you. It's really quite complex to have a global solidarity is what I'm gathering. However, but I'm hearing from you all that there's moments or opportunities to work together, and I think part of it is also understanding what's happening in these different contexts. And so I appreciate you all just sharing some of those things that are happening within the context that you're working with. And so I think you were talking a little bit about this language. And kind of the idea of solidarity, it's there's multiple meanings across different contexts. So I want to talk about language and go to one question about the movements for fighting for the rights of mad and disabled people use different language globally. So there's different tactics and language. There's also diverse goals. So how can we build this collective power while acknowledging that there's many differences across all of these movements, and the using these words like global north, global south, right? There's no monolith. There's very many different ways of thinking across all of these different contexts. So yeah, for anyone to jump in.
I can jump on. Jump in. I think it's true. I mean, we use different frameworks, different tactics, different language, and I don't know if sometimes we have actually very diverse goals. I think more like it's not so evident that we're sharing a common purpose to do the change we want in our communities, and I think that's one of the challenges, that because we use different language, different tactics, and sometimes apparently we have different goals, we feel we don't need to talk to each other, and we can do our work with those that actually agree with us, and I think that's a huge mistake. I think we cannot actually build power if we are not connecting our different struggles and different agendas, and having a way to deal with the difference in a productive way, not in a way that create division. And going back to what you said about the Convention on the Rights of Persons with Disabilities, that is a magnificent document that has really helped us to build many of our language tactics and goals. I would say also that I think we need to be very careful on differentiating between the tools and our own goals. And I think sometimes I feel, to some extent, we're just projecting what we think the Convention on the Rights of Persons with Disabilities want us to do, rather than what our own communities want us to do. And just to put an example, I think the language of psychosocial disabilities, which is not technically in the convention, but is part of the development and understanding of the convention. Well, to be fair, in Red Esfera, I think most people don't identify as a person with psychosocial disability. They identify as mad activists, or some of them users or survivors of psychiatry. And we use, to be honest, in a very strategic and opportunistic way, psychosocial disabilities when it's needed, just to be clear that we are under the protection of the Convention on the Rights of Persons with Disabilities. But I have seen also a lot of people saying, no, I will change my language now. I have a new identity because this is what the convention says. And also in terms of the tactics, I've seen so much resources pour into learning by heart articles of the convention, and I'm not sure this is very useful for people. I think it's more useful to know how to, especially grassroots activities, is more useful. It's important to know your rights, but I think it's equally important, or even more important, to know how to organize, how to mobilize, how to take direct action. And I don't know, I'm just trying to express that I think it's very important that we don't feel that an important document like the convention limit our imagination or frame our work. And I feel sometimes happens. Like we cannot imagine solutions that goes away from, I mean, some that has been always there, like litigation, which is a very important tool, of course, but in some countries it doesn't mean anything when you don't have a rule of law. Or contacting the UN, let's report this to the special rapporteur or report this to the committee. Okay, important to get that. Just don't limit all your strategy there. There is a lot we can do together if we work with unions, if we work with other collectives that are impacted, but or if we just ask for solidarity with other groups that we operate in the same ecosystem. I think it's very important to really question our tactics, especially now that the stakes are higher.
Yes, thank you, Alberto. And I know that in the context of Uganda and the organizing there, Benin, that the terminology of psychosocial disability in the CRPD was a very, very important organizing tool and movement building. So I'm curious for you to talk about the language that is used in this context or the tactics that is used in your context as well.
May also add some comments on this. There are many shades, I think, of this issue, and I think it's price of democracy which we pay if it is diversity of views, but also terminology. And on some occasions, when I was special rapporteur, I wanted, for example, to elaborate more on autism in my reports, but it was so difficult to find because there are so many views on this, and you are happy about this diversity, but then you are lost about how to recommend something, because if you recommend something, for sure, most of people will not agree. I mean, of course, for special rapporteur, it's not important to please someone, but still, this diversity complicates our work, but it is unavoidable. But then we should know where discriminatory wording, yes, terminology starts, and there we should be firm and united. And one of biggest challenges again is that medical world opposes CRPD, and I should say I'm not so very successful in my medical school when I try to tell to colleagues or students, and they, with all respect, they will not understand what is wrong to tell this person is ill with schizophrenia. This patient is ill with schizophrenia. Okay, they don't say any longer that the person is ill with autism because they were educated, but that autism is disability and not illness, but schizophrenia for them is illness, and that's it. And this is how is in textbooks, and this is against CRPD. So what do we do with that? And I think behind this conflict is this impasse situation with in general, with the CRPD, with the ban of non-consensual measures. It's a very deep conflict because doctors will say that this is their duty to help patients, and they justify then coercion. So the words they are not without. Behind words there is always, as we know, ideas, and the question for us is which diversity we support, enjoy, and celebrate in wording and terminology, and where we stop and say no, we strongly disagree. So I am raising these issues, which are very, very, very practical. Can we reach some agreement, or it is impossible to reach agreement, like it happens with impasse situation in general so far?
Yeah, thank you very much, Press. I think to add on what you have said, when it comes to terms of terminologies that are used, the language, for example, in the global south, the language has been very much influenced by the Western world, given the fact that there were colonial masters, and you find that even in most of the laws that are within the colonies, you find that the language is tapped from their colonial masters. For example, in Uganda, we're colony of the UK, and the custodial act in line with mental health was more of a duplicate from the UK act. So language really matters a lot, as in line with our colonial masters, former colonial masters. There was a great influence on language that we use. Thank you.
Yeah, I was thinking to resonate with all the conversation that the language, psychiatric language sometimes is useful when you're speaking about like the benefits, social security, like when a person has a diagnosis, can get like some pension, I don't know how you say that in English, from the state. And that's also like ambivalent because at the same time, when you link social security with the psychiatric diagnosis, I think we kind of lost the control of the clinical practice. Like some people, I will not say have this specific diagnosis, but live in a country with social inequalities and thinking that mental health problems also is related to economic issues and citizenship. Language has like the different kind of useful ways, but at the same time, I think it reduced a little bit the capacity of like transforming in ways of think about mental health. And also in the anti-asylum movement in Brazil, we have like the culture production, that something that I've been talking about, like is very important. And now we have the carnival happening like in 2 weeks. And we have like the Mad Pride that's also seeing themselves as artists and as cultural producers beyond like the diagnose or like being also recognizing themselves as mad people or with some psychosocial disabilities. So like, I think when these festivities, very specific in Brazilian culture happens, it's kind of like the people see themselves in different ways of like mental health language. And I think that's very like special to think about these collective strategies and how we like can go beyond and create something that's like beyond the psychiatry language, but also recognizing how is intertwined with our way of care here. So yeah, it's very ambivalent to talk about that.
Yes, thank you. I'm so glad we're talking about the language because, what I'm hearing everyone is talking about how the psychiatric language can be so limiting, yet there's can be benefits to getting the medication covered by insurances or whatever. And then speaking about the opening up through these kind of rights-based lens with CRPD, opening up to outside of a diagnosis to more of, I'm thinking about Bhargavi, who talks about how it was a way of seeing what are the things I need to make my life satisfying. And I think that being a rights sort of approach, because I have the right to have a satisfying life. And what are the things that will accompany that? And what are the things that I need to fight through a legal perspective for that to exist? And I think that's a very different framework shift that has been allowed to be created in contexts where people are moving outside of the kind of psychiatric diagnosis lens. And at the same time, it makes it difficult to connect with these more Western contexts and find commonality with how we're working together. So I just wanted to say that as well. Does anybody have anything else they would like to add? Otherwise, we might have some time to have a few questions from the audience. Okay, maybe I can just have a few people from the audience share. I do see I have one question specifically for Daniela here, and then maybe I can open it up to a few others. But just because I saw it right now from Ann Casper asking, Daniela, how is the Brazilian spirituality treatment going? We hear about that spiritual healing was in the hospital system there that isn't any other place on earth. Are there spiritual activists in your movement coming from spiritual solutions?
Sorry, what do you mean by spiritual treatment? Like religious, or just to understand better?
That's a good question. I can't say I know enough.
If I could just speak.
Yeah, sure.
Yeah. I've heard about in Brazil, there's a thing called spiritualism. And in some hospitals, they actually work from the spiritual viewpoint. I mean, I could look it up and get you references if you haven't heard of it. But I've heard people going down there and other places that the hospitals actually accept you speaking about spiritual things and helping you move through that without judgment.
I'm not so aware of that, but I can say a little bit like how religious enter like in the mental health care. I think in the Brazilian culture it's very important, like the religious space, and also think about the mental health system and care. Like the families are very engaged with the treatment of the mental health users, and most of the families has their like religious what they choose as spiritual healing. And in the treatment, like it's not that in the mental health care we implement that as a specific treatment, but also like we cannot talk about mental health treatment without speaking with the families and mental health users about their spirituality, because it's very related in the culture and the daily lives. But I never heard about like this spiritual healing as specific in a hospital, but I could say also we have, in a bad way, we have the community therapy system. I don't know if that's a word in English, but it's where it's a kind of new clothing for psychiatry institutions now, where people who have problems with alcohol and drugs and also mental health problems, they like go in these institutions, and they're like Christian evangelical churches that implement them, and also with the extreme right wing in Brazil. So this kind of relationship, and it's very bad because people go there and suffer like violence, and they are like they have to be Christians. So there's a lot like of human rights backlash in this kind of institution. So yeah, this is what I can say now. But I don't know if you are also talking about indigenous spiritual solutions. Is that something I just came to my mind right now? Is that something that you read about it? Like the ayahuasca?
No, it was just in the hospital system, and I found it fascinating. Other people go down there to study it, but that's okay if you don't know. We can talk about that later. But also, just thinking from spirituality, because for a lot of us, our mental health is tied to our spiritual experiences, and thinking about all activists, how do we work from that together?
Yeah, exactly.
Yeah, thank you very much, Daniela. I think I would love to share an experience here in Uganda where you find that, people who suffer mental health challenges are spiritually attacked, and they find more solace in churches and in traditional healers' places. And you find that the real spiritual healing and faith healing plays an important role in the recovery of people with mental health challenges, Amidst the challenge, they strongly believe there is a supernatural power that is behind it, and seeking intervention of spiritual healers, and praying as they go to churches. Spiritual intervention is as the traditional healers' places, many people strongly believe there are demons behind mental illness, and the moment they go to churches, they are prayed for. You find that they tend to be at a high, they are more healed than those who only depend on biomedical treatment. It is something that is common here in Uganda, and at the first episode, when someone really breaks down due to a mental health challenge here in Uganda or in Africa, one thing they have to think about is going to a traditional healer. They strongly believe these are spirits. This is something supernatural that needs a spiritual intervention. So you may find that even in hospitals, delegations from churches go and visit to offer support and also pray for patients. It is not prescribed, that they strongly believe it is an intervention that is relevant in the recovery of people with mental health problems here in Uganda.
And then I also recall when you were speaking about this experience of spiritual intervention for your interview, some of your own experiences, but where they were kind of difficult. I was wondering if you wanted to speak about that as well, because I think a lot of people maybe also have this glamorized view of these maybe spiritual interventions, but they can also be not so helpful for everyone. So
yeah, sure. Thank you very much. I think actually, I'm always inspired to share my experience because it really reflects the experience of many other people that you may find. And in my personal experience, when I broke down, with I was diagnosed with bipolar disorder. I was taken to a hospital, but after diagnosing and treating me for about 1.5 weeks, my family was advised that actually this was not something medical and it required maybe intervention of ancestral spirits to wash away the curses, as the community believes that this is something that is supernatural, and maybe someone suffers from a mental health problem when they are cursed or they did something wrong to their ancestors. So at first I was taken to church, I was prayed for. I come from a Christian family, but after prayers, still my family members, my relatives were advised that no, I think it's better you seek intervention from a traditional healer. And it was really a very difficult experience because when I was taken at traditional healer's place, I was shocked simply because I had excessive energy. I was, irritable, and the traditional healers strongly believe that I needed to concentrate in one place so that he can do everything possible that is required for my healing. And you find that even a traditional healer's place, this is something that's common here in Uganda, but I was given a cup of herbal medicine that really sedated me, and it knocked me off for the whole night, coming back to my conscious the following morning. And I was like, oh, I'm in a strange place. I'd been shackled, I could not leave the place, but still this was something that brings healing. One, it is believed the patient heals, and as well, the family members or the relatives concede that actually what they are doing is the best and their intervention would be, of a positive outcome. And, this is something that happens to many patients. And given my knowledge of Christianity, I strongly believe this could not work. However, my family was pleased with it, and I had to start traditional healer's place for about 2 months, administering herbal medicine, washing me, steaming and all that sort of things. Not until I was released, I had to go and I settled in a church because the church was receptive. My senior pastor had prayed for and counseled many people with mental health challenges, and some of them had healed. Actually, he advises them to take conventional medicine, but at the same time being prayed for. and seeking prayers from the, the Almighty God, as we believe. And, a number of people that visit, churches, and especially the church where I stayed for about 1 year, 1 full year. I was at church, I was being cared for by the pastor, the church community was so loving. And you find that when someone suffers, a mental illness, I think the church is more loving. Traditional healers are more loving and they are more receptive. And, these are immediate within the community. They make the first contact to a patient when they break down due to mental health problems. And you find that the majority of people with mental health problems go to hospitals and psychiatric units as a last resort after undergoing all such kinds of spiritual intervention from churches and traditional healers' places. That is something that is common here in Uganda and possibly Africa and the scope and the other countries as well. Yeah. So it brings solace and there's love. That is really very, very important in the recovery of persons with mental health challenges. Yeah.
Yeah, thank you, Benon, for sharing your story. And I think it speaks to this idea of like decolonizing and when we think of moving away from the psychiatric care, like what is the kind of care that we want to see in the world and in your local context. And obviously it was something that was difficult for you. So I guess my vision, I won't speak for you, but my vision is for everyone to be able to get the care that feels good for them, and maybe that's different on a case-by-case basis. But I wanted to put it to you all as sort of a last final question from the audience, to kind of come to the visions of like what is your vision of a world where we are have mental health liberation, and what does that look like? That this could be kind of smaller actions, or smaller examples, but what do you see as a vision of the kind of world that you would like to live in, based on all of our conversation today? What are some of the future visions you have?
Yeah, I think let me go first on that question. I would say that I would love to see a community that is free from stigma and discrimination, a community that respects, promotes and fulfills human rights of everyone, everywhere. I'd love to see such a community, where everyone really understands mental health problems. They are all aware and, they treat people who are affected directly as persons who deserve for rights and for dignity, and living independently in the community with all the support that is required. Briefly, that's what I have to say.
So it's a big question. So I'm also wondering if I can also ask, what are some small yet meaningful actions that we can take to build and sustain our approaches in the face of our current political turmoil? And maybe one minute or so for answering if you have something you would like to say.
I think a key aspect of all of this is really shifting the narratives and being able to be us, put the narratives out rather than being responding to someone else's narrative. I think that's a very important aspect of what you do in general in IDHA, but in general, many of us in this call and people listening, I think we shouldn't underestimate how important is shifting narratives about embracing, our diverse ways of being as something positive and tapping into the knowledge of our communities to build from there the responses that are needed. And And lastly, I think something I would like to see is how do we use the difference that we were talking before to build actually community and solidarity and action that can help us not only to resist, but to overcome.
Thank you, Alberto.
Maybe my vision is that although we see now regress with the human rights globally, especially after changes in Washington D.C. administration, but that means even more that those on the side of universal human rights principle, they should mobilize. There are many organizations, people, politicians. So we needed this during COVID, and I think there was some sobering understanding during COVID that human rights are important and mental health is important. And now with all these threats by some strongmen, we need revitalization of universal human rights principles, and if they are applied, in mental health care and beyond, this is the only way I see that can be successful. Maybe it sounds naive in current situation, but we are in Europe. We are now already alert in good way after some people coming from Washington D.C. and trying to moralize us, and we in Europe, I think we will be more respectful of human rights after such interventions. So they may be paradoxical, such interventions, and just I believe in human rights principles because they are in line with science, with evidence, and they are very, very powerful.
Yeah, that's a difficult question, but I was thinking that we need to, because we are talking about the difference and the different kinds of points of view and context and identity as well. And I think we are in a society that's very segmented, like we value the difference, but we stay in our bubbles, I think. And I think we need to find more intersection ways of points of encounter between this difference. And I'm saying that because I think power relations will always exist in a way. And I think this doesn't have like to impose a distance, but allow us like to have an encounter together. And one experience that's coming to my mind is when, like in this community center that I work, we make food collective, and every person share like their recipes from their grandmother and the place that they came from. And we are like a group of mental health professionals, but also people who live in the community with different like colors, race, identity. And but the time that we are cooking together and we eat together, like we find a way to encounter in this all this difference and all like the history of colonization and everything that is in our power relationship. So I think we need like to allow the difference to, we need to support more the difference, like the encounter with that, because that make more empathy, generate more empathy between people and make us like see different ways of living. And you know, I think this could help with all the prejudice in the world. And
I want to thank you all for such a beautiful panel, and I feel like I've learned a lot from this conversation tonight. And I also want to say that I think part of my vision is also a small and meaningful thing to take from this is for people in Western context to learn from the global South and learn from people who are historically have not had a voice when it comes to, mental health and human rights and the important activism that they are leading, in these contexts. So I feel like learning is really a really great way to start, and I feel like I've learned a lot from here tonight, and we're going to share the resources from what things have been said from tonight. And I also want to share another opportunity to learn as we are about to close. So if I could get the slides up. So I just wanted to briefly share about the Transformative Mental Health core curriculum, in which the panel was inspired by. We still have enrollment for this, and a lot of the topics tonight that were discussed are have a little bit of introduction into through this curriculum. So if you're interested in learning more about the global solidarity and resistance, and also the context in which that exists within the medical biomedical model, I encourage you to learn more here. This is a course online, and so you can take the curriculum by taking videos online with a range of 50 faculty, 2 of which are on this call tonight, bridging lived experience and professional. Primarily, it's for people who are working in the mental health system as practitioners, but it would apply to anybody really who is interested in this kind of knowledge. And so we have 2 approaches. You can take the curriculum self-paced, so you can move at your own pace, and you can also take it through a learning experience format, which is over a 4-month period with bi-weekly discussion groups. So the open enrollment for that is right now until February 28th. And we have a lot of different pricing scales, so we want to make it accessible to people as much as possible. This is all of our faculty. So 2 of the people that are on the panel tonight are part of our faculty. And yeah, this amazing group of people talking about transformative mental health. I won't go into too much depth about the modules here, but this is just giving you a sense of the kind of content. So the first is about transformative mental health. The curriculum talks about the importance of storytelling and narrative, which Alberto was just mentioning, and how we can use this in our care practices. And then we also talk about the biomedical model, how this medical model existed and has emerged. And then we talk about also how the mental health system has been intertwined with oppression, and what are the ways that race and gender and queer people have been impacted by the mental health system. And then we also talk about the resistance. So some of the resistance that was shared tonight with the global solidarity. And then we also talk about the Mad Pride movement, the consumer ex-patient survivor movement, all of these different movements, and the how it's contributed to the current activism today to fight for the liberation of all people who are diagnosed. And then once we go past that, it's more of an applied section where we talk about these different mental health experiences like substance use and suicide, extreme states that's also called schizophrenia, and how we can care for these experiences through a different kind of care modality. And then module 7, holistic care, is talking about all of the different care modalities, or not all of them, but some of them that exist that you could incorporate and think about, like using peer-based learning, or thinking about open dialogue, or some of these modalities that exist. And then 8 is finally putting into practice and talking about how you can incorporate this into your life and work. This is a curriculum that's available for CE credits, which we're very happy about. So if you're interested in getting CE credits, you can take the curriculum for that. And we're also happy that there's a New York certified peer specialist can get 20 CE credits for no additional cost. So I wanted to invite our panelists to come off mute and just share very briefly about their lessons in the curriculum. So I wanted to invite Danius to share about introduction to global landscape and about the UN and WHO.
Okay, so yes, it was a very good experience for me, and hopefully was helpful to audience. I prepared and presented two lessons, two video lessons, mainly sharing my lived experience because I did that after I just finished my 6 years of rapporteurship. So what is happening? I was sharing what is happening globally in this mental health and human rights field. So this introduction into landscape, and then special role of United Nations and World Health Organization, which I told now during this event also that quite unexpectedly and surprisingly for me, positively, they take leadership. UN Human Rights Council, which otherwise is not always friendly on human rights, was a driving force with resolutions, and we could see the role of Brazil, Portugal, and other countries moving the agenda. And I was happy to share this with the audience in the training, in the course. Yes, thank you.
Thank you, Danius. Yeah, these were really helpful grounding. So next, I wanted to invite Daniela to talk about the lessons, case study, the rise of psychiatry in Brazil, and also the psychiatric resistance in Brazil.
Yeah, in these two lessons, I try to give an overview about the psychiatry reform in Brazil and how I think Daniels mentioned before about this Italian psychiatry reform and how it shapes also the Brazilian context, but we have a different type of history. So I try in these lessons to explain a little bit of how unique and in the context of democracy, fight for democracy after the dictatorship in Brazil, the psychiatry reform started to have shape. And also how the rise of psychiatry happens with the colonization history and shape of the psychiatry institutions. So I try to give overview about the Brazilian context and Latin America.
Thank you, Daniela. Yeah, these were really fascinating lessons. So next, I wanted to invite Benon to just briefly, I already mentioned, but was part of our project by interviewing. So if you wanted to just share briefly about this.
Thank you very much, everyone. It has been really a great privilege to, be a panelist on this event. You find that I was part of the core curriculum interviewees as a lived experience expert from the Global South, and that is specifically Uganda. And in my experience, I was speaking about, my personal experiences of community interventions, getting support from the community, right from the family members, the relatives, and including the church that I've already talked about, and my experience with traditional healers, and finally getting into institutions and how all these systems played hand in hand to foster my recovery. And currently working as the founder and executive director of the Mental Health Recovery Initiative based in Kampala, Uganda. Thank you so much.
Thank you, Benon. So grateful that we could have you integrate into this curriculum this way. And then last but not least, I wanted to invite Alberto, since we included the Lima Declaration. You already talked about Red Esfera, but if you wanted to just briefly share about the Lima Declaration.
Yes, I can do that. So the Lima Declaration is the foundational document of what it was called at that point, Red Esfera Latinoamericana de la Diversidad Psicosocial, like Latin American Network Psychosocial Diversity. And now we have a different name, as I mentioned, is for las culturas locas, la diversidad psicosocial, la justicia, el buen vivir, y el derecho al delirio. And as I mentioned, we are a regional network in Latin America, and I think the new name tries to reflect all these different aspects of what we believe as part of this collective. This document was adopted at the outcome of our first General Assembly, which was a regional meeting in December 2018 in Lima, Peru. And basically what it aims to share is who we are, what do we believe, what we demand, and to some extent what we dream, no? What we dream of. And it's a statement of principles, but I would say more importantly, it's a call. It's a call for the respect of our rights, to embrace diversity and mad pride, to reimagine responses to madness and diversity, and to work with our own lens, our lens from the global south, from Latin America, grounded in the knowledge of our own communities. No, I think that was very important for us at that moment.
Thank you so much, Alberto, and I'm really grateful that we could incorporate the Lima Declaration into the curriculum. You can enroll in the curriculum still for the learning experience. So if you're interested, we recommend that you enroll soon because our seats are filling up. But we have 3 different cohorts times to enroll with. So you can visit the link in the chat. And yeah, self-paced, you can enroll whenever. It doesn't impact the timing. So for this event, we really value your feedback. This is something we take very, very seriously and incorporate in IDHA. So you are really invited to share your feedback about the event, how you felt about it. In the follow-up email in the coming days, you'll get the recording, you'll get the closed caption from the event, the transcripts. You'll also get the feedback form again, and we would love your feedback. We also invite you to stay within community with us. So if you are interested in being part of a community of people in mental health that are looking to change it, we are very much would be happy for you to become a member of IDHA. And so here's some information about how you can become a member and join us. We invite you to stay in touch with us. We have a newsletter you can sign up for on our website. We also have Instagram, Twitter, Facebook. So we would love for you to stay in touch with us. So for all the people who are still here on this panel call, I want to maybe you can just put some thank you to our lovely, lovely panelists tonight who joined us. Thank you so much. We're so honored and grateful for your time and your wisdom and expertise. And just really glad also, I think someone named this in the chat for your English tonight, because this is not something I take for granted, to be speaking in a language that's maybe not your language, and so thank you for being here, and we're very deeply grateful. So thank you for all of our participants tonight, and I hope that you stay in touch with us and join our community, and I hope you have a great rest of your day wherever you are tuning from. So thank you. Take care, everybody.